First, back in July, there was the conspiracy theory that health reform was a secret plot to kill old people. Then, starting last month, the new conspiracy theory that health reform was a secret plot to deny health care to veterans. Then, just last week, we learned from the Republican National Committee of a brand new one, that health care reform was a secret plot to dole out health care only to Democrats. It was a secret plot to kill off people registered to vote as Republicans by preventing Republicans from getting any health care. That one was so bad the Republicans even had to apologize for it. But now that it's a new week, we have yet another new I can't believe it conspiracy theory. Another plot to scare a group of Americans who are apparently perceived to be vulnerable to these scare tactics into opposing health care reform. The new target, it's not old people or veterans or Republicans. This time, it's women with breast cancer. No, I am not kidding.
If you find a lump, you could wait months for treatment, and potentially life-saving drugs could be restricted. Government control of health care here could have meant that 300,000 American women with breast cancer might have died. My odds of surviving cancer were high because my care was the best. What are your odds if the government takes over your health care?
Go to Independent Women's Forum to share your story.
See, health reform, it's a secret plot to kill hundreds of thousands of American women with breast cancer. That ad is being broadcast in a multi-million-dollar ad buy in 8 states. It was done by a conservative group called the Independent Women's Forum. We called them for comment today. We're still waiting for their response. And as reported by Michelle Goldberg today at the Daily Beast, the Independent Women's Forum has also sent out a fundraising email covering the same scare tactics territory. The email has the subtle subject line, quote, "More American women are going to die." After that bucket of O Fortuna in the face, the letter begins, quote, "More American women are going to die of breast cancer if you and I surrender to President Obama's nationalized health care onslaught. Real people might not make it if President Obama inflicts his nationalized health care on America. So be afraid, women with breast cancer. Health reform is a secret plot to kill you." Pay no attention to the fact that every major breast cancer advocacy group in the country supports health care reform. The Independent Women's Forum wants you to be afraid and also to send them a big check. Joining us now is Terry O'Neill. She's president of the National Organization for Women. Ms. O'Neill, thanks very much for joining us tonight.
Thank you.
Let me start by getting your reaction to this new ad, specifically targeting women with breast cancer. What do you think?
Well, I saw the video. I went online and looked at it, and it made me mad. I don't like being lied to and manipulated. I don't think women in this country like it. You know, women are bearing the brunt of the broken health care system, and we know what we need, and what we certainly don't need is scare tactics claiming that women with breast cancer are suddenly going to die if we have health care reform. It's outrageous.
Well, we have seen a lot of different groups being targeted by anti-health reform forces, senior citizens, veterans. There was that weird thing about Republicans. We haven't heard a lot about women being targeted with these be afraid tactics. Do you think that women are specifically being targeted just more under the radar than this obvious big new front?
Well, I think this is new, targeting women in this particular way, but I will say that it is not new for extremists in the Republican Party to use women's need for reproductive health services as a political football. And breast cancer is part of the spectrum of reproductive health care services that women are impacted by, right? But before they came out with these kinds of deceptive ads, the Republicans in Congress were trying to pass amendments that would stop women from having access to a range of reproductive health care services should health care reform actually pass. I view that as a means of trying to derail health care reform altogether, but by using women's bodies as a political football in that effort.
Well, your organization, the National Organization for Women, obviously has a singular focus on women's issues. In terms of health care policy that's being debated right now, what is your position on what sort of plan, what sort of reform would be most beneficial for women?
Well, what women really need is a single-payer health care system. You know, women have higher health care costs, largely because of reproductive health care needs. Prenatal care and childbirth care is the biggest driver of the increased costs. Right now, women have less access to health insurance than men do because we work part-time. In part-time jobs don't pay benefits, or women also are disproportionately represented among minimum wage jobs and on non-union jobs. Again, these are jobs without health care. And as long as we have a health care system that depends on employers to provide health insurance, women are not going to have enough insurance. So even when we have insurance, we pay too much for it. And very often, things like pregnancy is considered a pre-existing condition. So if you're pregnant when you get that job with health care, you don't have your prenatal care covered. And guess what? Women who don't get prenatal care who are pregnant have 2 to 3 times more likely to suffer maternal morbidity or mortality. Infants have a 6 times higher likelihood of mortality if their mom doesn't have prenatal care. So it's incredibly important. And where are the right-wingers who are scaring us with these breast cancer claims? Where are they if they care so much about women with breast cancer? Let's have them call for full coverage for women so that we can be protected against that kind of thing.
Terry O'Neill, president of the National Organization for Women. You let me know if any of those people get in touch with you with an offer to do that, okay?
I will.
Thank you.